Hello, good evening. Yeah, I'm good. All right, head and neck, no? Sure. So we'll start with head and neck, and it will take about maybe say 10 days at the most. So by the end of first week, we should be starting head and neck. Regarding the thorax, say there are few emails and they have requested to go through the thorax. I really insist that first you just go through the heart part, right? There are ample films we have put on our channel on heart. So just go through it. And regarding the lungs, no problem. I think we can take it in the form of a long session on Sunday, right? So roughly about say you have to develop the capacity of about say 3-4 hours, right? So in single shot we'll finish it, because truly speaking, yeah, as Atharu said, and even I got few more emails also, head and neck is tricky. At times you'll feel like that abhi to padha, and suddenly you start mixing up the things. It happens, right? So there are few very interesting tricks about how to remember. The way we are going in the abdomen, actually the chapter wise, it might not happen in case of head and neck, because in head and neck, initially exactly like that upper limb lower limb, first two or three sessions will be constructing the skeleton, will be constructing the concept, and then we'll start inserting those nerves one by one without worrying about that from brain, from where are they coming. No need to worry about that. And then we'll start inserting muscles, and that's how we'll create the whole picture. Then we'll go step by step for all the topics, right? To complete abdomen, I think this is now the final lap of this marathon. So about five days. But say today and tomorrow, right, we'll be discussing perineum. The entire concept is based on this perineum only. Once this is clearly understood, then rest of the topics they will go move really fast. So perineum I have divided in two parts. Today we'll understand the concept of perineum plus the male perineum, and tomorrow it would be the female perineum. Right, so that's how we'll do. This is the official disclaimer. Image is displayed during. I have to speak. Sorry. So images displayed during this medical training session are for educational purpose only, and not all images are suitable for audience of all ages. And images displayed explained are for medical education and address mature audience. All right. So let's start with our today's topic. So that's perineum, right? Okay. Now see, just a minute. Thank you. So in perineum, we shall be taking care of this hip bone or innominate bone. So you know very well the ischial tuberosity, right? Ischial tuberosity is that part on which we really sit. This will be playing a vital role in understanding pelvis. Innominate bone or hip bone, it is comprising of ilium, ischium, and spine. Ilium, ischium, and pubis, right? So that's the ischium, and the spine is ischial spine. There is lesser sciatic notch, right? And the pubic symphysis where those two bones meet. Don't worry about the pudendal canal at this point of time. And perennial membrane, yes, this is the membrane which we'll be discussing at length. So our today's focus would be perennial membrane. Once the perennial membrane is clear, pudendal canal is a piece of cake, right? It is very easy. All right. So this would be our game plan, right? Say perineum, and we have divided into two parts. So today would be the male, and tomorrow we'll be discussing the female perineum, right? Though there would be few common concepts. Those concepts we'll be discussing today. And then tomorrow we'll even revise it. Right? We'll revise it. So that way the concept and the understanding would become very solid. Right? So when we say perineum, it is at the lower end of the trunk, right? Lower end of trunk. And this is that interval which is between two thighs. So in lithotomy position, when we say lithotomy, that means when the person is say these are the buttocks and the legs, they are kept like this. So this region, right? What is when you see? So this is the interval or the space between two thighs. And by the way, this position, right, in which the legs, these are the knees, right, and this is what is called as the lithotomy position. Now, say perineum is important because this is the location of external genitalia, right, or external genitals. This is the location. So in case of male, we'll see that there'll be two openings, right? One opening which is for GIT, and that is the anus, and second, that is for the urogenital. Because in case of males, for the urinary system and the genital system, right, there is only one opening, right? There is only one organ, penis. In case of female, however, there would be three openings, right? So there will be one for GIT, second would be for urinary, and third obviously is for, I think, for the genitals or the reproductive system. Yeah, I hate reading that disclaimer. You are so right, but can't help. Seriously, technically I have to speak. Okay, now say this, right? This is all these images, they are for pure understanding, and we divide. Say, okay, well, if we start from the full body, right? It's like in head and neck also there would be one diaphragm. So this is like head and neck. There would be diaphragm. Then there'll be thorax, right? And we know very well that between thorax and abdomen there was diaphragm, right? And then there'll be one more diaphragm, and there will be pelvis over here, and then here is the perineum. Perineum. Say it is this chapter, that is today's session and tomorrow's session, right? There would be lots of visualization, lots of confusion at times. कह रहे, अभी तो ये बोला, अभी ये. So we'll try to see the things in a very step-by-step way. Right? Number of pages, number of images, they are very less. The only thing which I insist is the concept. You need to understand. But that's it. Right? So over here, this is like pelvic cavity. Right? Pelvic cavity. And there would be perineum. Right? And when we'll proceed further, right, we'll see that how the diaphragms, they will be coming into picture, right? So it is this area which is in focus today. Now let's see it in more detail. Say if I tell you that this is a sagittal section, right? So we are, right, we just take a section, and what we see is that, let's say this is pelvic cavity, right? That's the pelvic cavity. Now we are dividing this pelvic cavity into two parts. That is, this lower region we are dividing. This lower region, this front one, this is anterior, right? That's anterior. So this is what is called as urogenital region. So it makes sense because posterior would be the anal region. Correct? That would be the anal region. Collectively, this entire thing is perineum. Perineum is like the lowest end of the trunk, right? So this is clear, right? Dividing. Yeah, this is posterior, right? That one is posterior. Now, once again, we go still further. Right? We are adding step by step. Once again, dividing, this would be pelvic cavity, right, or the pelvis. And now dividing, and then once again we are dividing it like this. Right? This is a complete schematic diagram, but then we'll actually see that how it forms. So anterior, posterior, and this entire thing, we said that it is a urogenital region. So urogenital region, from now onwards, we'll just write UG, right? This is, you know it very well, this is anal region. And now this top and bottom. So here is, we'll call this as deep pouch, because from here, this is superficial, correct? Because it is the end of the body. So this is superficial pouch. Now there'll be lots of games over here about various fascias, this, that, everything, no worries, right? So this much is fine. Now over here, what exactly we drew over here, that is nothing, but just remember it is a sort of thickened fascia, right? It is a sort of thickened fascia. And we'll give the name urogenital diaphragm. Fine. And yes, this is perineum. So here is like male perineum. This is the boundary, right? It's a diamond shaped, and this position is what is called as the lithotomy position. So over here, the boundaries would be, obviously this is anterior, right? And this one is posterior. Change the color, right? So anteriorly, it would be penis and scrotum. So that is anteriorly, correct? Right? Plus the scrotum. So that is also anterior. On the sides, it is the medial part of thigh. So that is quite self-explanatory, right? And the posterior part, that is the fold of buttocks, right? So in this region, right, it is the anus which is involved. And these are also like the outlines of pelvic outlet. So we'll come to that pelvic outlet, but these are the superficial boundaries, right? Technically speaking, these are the superficial boundaries. Okay. When it will come to, say, female, there is not much of the difference, right? The only important part is, as we discussed, that it would be a sort of that in male there were two openings, in female there'll be three openings, right? There'll be urethral orifice, right? There'll be vaginal orifice and the anus. Otherwise, anterior, posterior, and the sides, they all are quite similar, right? Accordingly, the organs will change. So this is for female. Regarding female perineum, yes, tomorrow we'll be discussing it at length. So today our focus would be on male perineum. Some common concepts, that's what we'll be discussing. Now see, orient yourself properly for this. So if I really draw it, it would be like this, right? So it would be like this. So that's coccyx, right? Pubic symphysis. So immediately we figure out that what we are talking about is the deep boundaries now. right? These are the deep boundaries. Previously, it was superficial. So here is in anterior, right? There is pubic symphysis, makes sense. Arcuate pubic ligament, yes, that is also quite fine, right? And this is ischiopubic rami. So this much portion in itself, it tells that yes, that is anterior. So that is good. Okay. Posterior, that is also making sense, that is coccyx, and on the lateral side this is sacrotuberous ligament, right? That is the sacrotuberous ligament. So nothing very special, all easy. Point to see is this line, right? This line, this dot dash line, right? This dashed line is between, it is ischial line, right? Between that ischial tuberosity. Say, just remember, this is anterior, right? And this one is posterior, correct? So what we are watching is just the boundaries. Previously, it was like superficial. Now skin and everything is removed and we are watching just the bones and the ligament, right? And that's the point. That there is one important, and that is the perineal body. This is what is called as the perineal body. Perineal body will be a huge topic, very vital topic. Yes, we'll be discussing that thing today. So that is perineal body, right? What it is, etc. Right? Just hold on. This is dividing that entire diamond-shaped structure into two triangles, and this is what is called as urogenital region, and you must have guessed this is anal region, right? Anal region. Now you try to figure out that what we were talking about, right? What we were discussing over there was exactly this, right? In fact, this, correct? So urogenital region, that is anteriorly, and this is the anal region, that is posteriorly, right? Not very difficult, right? Easy to understand. Okay. Let's add something extra into this. So over here, urogenital region, very specific that it will be for all external genital organs, right? Or the external genitals. And anal region, that is where the anal canal would open. So that is easy. Now, out of all this, right? If you really see that it is the perineal body, right? Which is over there, and this above is also called as urogenital triangle, right? So just keep in mind it is urogenital triangle or the region. Okay. For this, S2, S3, S4, this thing will keep on getting repeated. So that's why I'm telling you in advance, right? This is the cutaneous innervation, right? This is cutaneous innervation. Then it will not come back again. So just remember S2, S3, S4 and S4. This would be the perineal branch. And S2, S3, S4, right? That is the root value of inferior rectal. Now, inferior rectal, superior rectal, all those, they will come in great detail. But because we are discussing perineum, so the skin around anus and the ischioanal fossa, that is by it, and the skin which is posterior to anus, that is by perineal branch of S4. So just remember, this is skin posterior to anus. That is by this perineal branch, and this inferior rectal, that is for almost rest of the area, right? To the skin around anus, plus the new word ischio anal fossa. Now what it is? Again, it is a topic, right? It is one of the topic. Okay. Regarding the fascia, superficial and deep, and this superficial will once again be dividing into two parts, right? So think it like that it is this deep fascia. This is the fascia. Obviously, it is deep, right? This is the fascia of pelvic diaphragm, and there would be one more muscle which will be playing a crucial role, and that is the obturator internus, right? And we'll be coming across this muscle again and again. So that is quite deep. Superficial, yes, it would be pretty superficial, and that is once again ischio anal fossa. Now this is creating suspense, right? So once again, this name has come, right? And we add one characteristic, it is fat filled. All right. So we need to see that where exactly it is coming up. Now see, same position, right? Every time it would be this position only. Perineal body. This perineal body is comprising a landing point for 10 muscles. Yes, right? This is like fibro muscular node, a place where 10 muscles will be landing, and we'll be discussing all those 10 muscles. Posterior to it, yes, that is all easy, right? So let's start with those muscles first, and then we'll be discussing about it. Which 10 muscles? Now at this point, it is completely fine if you don't remember all the 10 muscles, right? No need to worry. So that's the anus, and it is in front of the anus, this perineal body, right? About half inch in front. So first thing first, that this external anal sphincter, right? See, this is the external anal sphincter. This is first muscle. Now this muscle, external anal sphincter, this is around the anal canal, right? So there is only one, right? It is external anal sphincter. This is not a paired structure, right? Then say levator ani, right? Levator ani. Name itself it's telling that one who is elevating, levator means elevation, the anal canal. This muscle is vital for the defecation process, right? So it is on both the sides. So here one, here two, see they are landing onto that perineal body. So we'll say 2 and 3. So this part was easy. So this was the posterior part. Now in the middle part, these are transverse. Transverse and transverse. One is superficial, one is deep, right? Deep is actually deep, so we won't be able to see it very properly, but over here diagrammatically it is shown. So fine, it is easy for us. So 2, 3 will on say 4, 5, because again it is a paired structure, right? So superficial first and deep are 6 and 7. So this boils down to actually when we say 10 muscles, but see they are so easy, external anal sphincter and levator ani, right? The keyword anal and ani. Then the transverses, here also transverses. So 7 down, right? Next, Say this is bulbospongiosus. This is this muscle which is on the anterior aspect, right? This, now we are on the anterior aspect. So this is 7, that's 8 and 9, right? That is bulbospongiosus. Where is the 10th one? Right? Only one is left out. This 10th one we won't be able to see actually. This 10th muscle, it is the longitudinal muscular coat, right? It is the longitudinal muscle of anal canal. So in other section, when we'll talk about it, we'll see this, right? So thus these are the 10 muscles, right? Okay. Regarding the ligament part, see this anococcygeal. No introduction is needed. From anal canal, and this is the coccygeal, coccyx, right? So from anus to the tip of coccyx. That is easy, right? That's it. This much is to be understood. Now, in case of female, this pineal body that would play a very major role, because in male though it supports rectum, right? But in case of female, it supports all major female organs. And say during the childbirth, sometimes the cut is to be put, which is called as the episiotomy, right? We'll discuss it in detail tomorrow. But at that point, if this perineal body is damaged, it can lead to so many problems, so many complications, right? So in case of males, yes, it supports rectum and say, right, this supports rectum, that anococcygeal ligament, right? And say levator ani, external anal sphincter, these are the sphincters, and these are the muscles which are for this particular area. So for the perineal body, it was easy when the figure was over there. Now without figure, if someone starts asking, it becomes a bit difficult, right? So the easiest method to remember is blessed. First one, bulbospongiosus. So that difficult part is done. Now all are very easy, right? Say levator ani. So this bulbospongiosus was, yes, double, right? On both the sides. Levator ani, yes, on both the sides. Then third one was that external anal sphincter, right? Remember all sphincters, they are unpaired. So this would be 1, right? Then fourth one, that superficial transverse perineum, right? Sorry. Right? Superficial transversus perineum. And then there was deep transversus perineum. And in between, there was that sphincter urethra, internal sphincter urethra, right? So, levator ani, deep transverse, superficial transverse, bulbospongiosus, and that longitudinal muscle, right? That longitudinal. That longitudinal is also called as the sphincter, right? It is also a sphincter. So that longitudinal muscle. All the sphincters, they are 1, rest all are 2, 2. So we talked about that what's the importance of say perineum, right? Perineal body. Just for its importance, that perineal body, why it is so vital, right? And all these topics, all these, they'll be very important. What that lecture we were planning on our Zoom, right? So very soon we'll be planning. As soon as these topics are over, immediately, I think Saturday, we'll definitely be going for that. And yes, I got all those mails to add the your email, so don't worry about it. I'll do that. Right? So if this perineal body is damaged in case of female, that thing can be so serious it can lead to prolapse. Right? It can lead to prolapse of urinary bladder, uterus, right, rectum, and ovaries. Right? So all those things, they are pretty serious. Tomorrow we'll be talking in detail about this. And just remember this, it is what is called as the episiotomy, right? It is called as the episiotomy. That's the name of the procedure. Now here it is. This is the figure where there are so many things to be understood. These are anal sphincters, okay? Now in these anal sphincters, there are two. One is this internal anal sphincter, and other one is the superficial part of the external anal sphincter, deep part, right? So here it is deep part, this one is superficial part, and this is the subcutaneous part, right? This one is the deep part, this one is the superficial part, and that's the subcutaneous part. They are external anal sphincter. So this internal anal sphincter, right? So if we say this, if we divide it, this is rectum, right? So that's the rectum, and this one is, say, anal canal, right? That's the line, right? So this sphincter, this internal anal sphincter, that is taking care of almost upper 3/4 of the portion, right? This one, upper 3/4 portion, it is taken care. Now, what's the difference? This is like what's called as white line of Hilton, right? It is this line what we are talking about. Now, there is substance called keratin. So that squamous epithelium, it could be keratinized or non-keratinized. So whenever there is friction, right, for the protection, there is keratinization. So this white line of Hilton is actually like a junction between, over here, it is non-keratinized epithelium, right? It is non-keratinized, and over here, it is keratinized, right? So that junction is what is called as the white line of Hilton, and this internal anal sphincter is above that white line of Hilton. Right? All those deep anal, deep part of external anal, superficial and subcutaneous part, all of them, they are under voluntary control. Voluntary control. Right? Control. So they will be supplied by same thing what we were learning, S2, S3, S4, and that is inferior rectal nerve. That's right. Plus one more thing, S4, and that is that perineal branch. So it becomes much easier. This thing will keep on repeating at so many places, right? So because it is under voluntary control, so normally it is closed. Okay, so when we say this white line of Hilton, just for the theory purpose, this is also known as inocutaneous line, right? It is also called as the cutaneous line, and we talked about that it is like a junction between keratin, that is keratinized epithelium, and the non-keratinized epithelium, right? And you know about this squamous epithelium, right? Squamous epithelium. So they are all those flat structures, right? Flat. And when there is keratin, so it is like it will be forming a extra layer, right? That is what is called as keratin. Just for the history purpose, this thing was the gentleman who said this thing was John Hilton. Right. So that's why Hilton's white line of Hilton. Okay. Now adding something extra. Till this point, we were talking about, say, ischial tuberosity. That makes sense, right? This is sacrotuberous ligament. That is also easy. Okay. Then external anal sphincter. Yes, so that is anus, and around it, it is external anal sphincter. So that is also fine. This area, right? This part. This is ischioanal fossa, right? Ischio, that's the ischial tuberosity, and the anal canal is over here. So this portion is ischioanal fossa on both the sides. Fine. Yeah, that is sacrotuberous ligament. And now this is ischioanal fossa. So now we know the location of ischioanal fossa. It is situated posterior, right? Posterior half into the anal region. Yeah, anal fossa, so it has to be the anal region. But this is the ischial tuberosity. The anterior portion, now we are coming up to that new term. That anterior portion was urogenital region, correct? Urogenital region. So this region is having one membrane, and that is what is called as the perineal membrane. This perineal membrane, its border, this border, right? This is a free border. This one, right? This is a free border. Now, because it is anteriorly urogenital region, so it has to be pierced by some structures, right? So in case of male, that is urethra, and in case of female, yes, it would be pierced by more structures, because in case of females, yes, the uterus, right, that will be landing, and it will also be going down, and there would be, say, another opening. Fine. So very conceptual thing, but today we are focusing only on male perineum. So that's anterior and that's posterior, right? So we learned two things in this. One, perineal membrane, right? Perineal membrane. And this perineal membrane, yes, it is attached along laterally, right? And posterior border is free. But this much is sufficient for this point of time. Moving further. Now adding lots of new things. Lots. First, let's orient ourselves properly. The structures which we already know. We know this part. Say, what do we know? Internal anal sphincter. Yes, we know this internal anal sphincter. So that was white line of Hilton. Yes, we know this part. Right? Let's start it this way. So white line of, sorry. So white line of Hilton, known. Internal anal sphincter, yes, we know that, right? Then this was that superficial part, right? That was the deep part, and this was superficial part. This was subcutaneous part. This is subcutaneous. This is superficial. This one is deep. So we mark this. This is also known to us, right? Okay, ischial tuberosity, very well known. Ischioanal space, yes, ischioanal space, yes, we saw that thing, right? But now it is giving us the reference. It is giving us a, and remember we said it is filled with fat, right? Okay, that is obturator internus, right? Now, how do we remember this? This is the ischial tuberosity. You remember the internal side, right? That was this obturator internus, and this is ischium, right? And say these, the longitudinal muscle coat of rectum, right? And it is this longitudinal coat which is going all the way, right? And that's the levator ani, right? This is the levator ani. Now, apart from this, all those structures, obturator fascia makes sense. Fascia which is covering this obturator internus, right? So that is easy. This lunate fascia, well, at this point of time, we are not very clear about it. So we'll just mark it and we'll leave it as it is, right? It will come again. So at that point, we'll discuss it again. Here is inferior fascia of pelvic diaphragm. This is interesting, right? So we need to talk about it. The suprategmental space, pudendal canal, right? All those things, we keep it on halt. Anal fascia. So as such, in this we learned the sphincters and these two muscles. One, levator ani, and second, this obturator fascia, and they are covered by their respective fascias, right? So obturator internus muscle and now see another perspective. This is a parasagittal section. Parasagittal. Right. So if this is the head, right? So that's sagittal. So this one is parasagittal. In this parasagittal section, watch for first orient ourselves. Let's orient. This is posterior. Right? That's anterior, obviously. Sacrum, gluteus maximus, that sacrotuberous ligament, right? So all those posterior structures. Fair enough. That's coccyx. And this is ischiopubic ramus. So that's our bony landmark. In this, see the levator ani, right? Levator ani. So this is a double structure. It is a paired structure. So same way it would be on the opposite side. If we take this section over here, so yes, it is here also, it is here also. It's a paired structure. So that is levator ani. But there is something like perineal membrane, right? You remember what was perineal membrane? Perineal membrane was the thickened fascia, right? That was the thickened fascia. So this thickened fascia is doing something. It is creating all those recesses. So over here, there is anterior recess, and over here, this is like a posterior recess. That's okay. But see superficial transverse perineum and all those ischio-cavernous and crusts of penis. Say these are all structures which are on the lateral side. So again, in this, let's mark out only two things. One, perineal membrane, right? And then we'll come back to this, right? So we draw one easy thing. Say pudendal canal you saw, right? Over here, this pudendal canal. The way we were remembering that porta hepatis, right? Hepatic artery, portal vein, and bile duct. Same way, pudendal canal, always remember just two structures, right? pudendal canal. One same nerve, right? Pudendal nerve and internal pudendal vessels. Us, right? It is internal pudendal vessels. Now see, in pelvis it happens like that. The structures, they are arranged in such a way that at times it would happen that from where the pudendal canal has come, and why I'm talking about these nerve and these vessels, it is just to make you comfortable that such structures would come, right? Because when we'll start discussing all those plexuses, at that point it will make sense. Yes, okay, this is the pudendal nerve, this is how it comes. But as we have talked about it, you'll be more and more comfortable with these names. Similarly, say there was ischioanal fossa, correct? Ischioanal fossa. So you know where was it, right? That was the ischioanal fossa, correct? This was the perennial body, right? Perennial body, which was comprising of 10 muscles, right? Those blessed, correct? And the supply was inferior rectal nerves, right? And the perineal branch of S4. So what would be the contents of ischioanal fossa? Exactly, those will be the contents, right? Who will be supplying it? So S2, S3, S4, and that's the root value of inferior rectal nerve. Second, say S4, and that is the perineal branch. So that is also good. Rest only that is posterior scrotal or labial, right? That is the nerve and vessel. Again, they are all cutaneous, posterior scrotal and labial nerve and vessels. Rest of the contents like fat, etc., that is very obvious. Okay, this would be where we are just understanding the entire structure again. Anterior, right? Arcuate pubic ligament, we know. You and this perineal membrane, we know it very well. And do write that this would be the free border, because that's the keyword of it, right? That's the free border. And in case of male, it is pierced by just there is one opening, that is urethra. All right, right. Then transverse perineal ligament. This is what will come when we'll be discussing few more topics, right? All these transverse perineal ligament, but we know this part, external anal sphincter, levator ani, right? That is very well known. Over here there would be perineal body, right? So yes, this levator ani, external anal sphincter, they all will be part of it. All right. Perineal branch of S4. Now this is not at all a new thing for us. And inferior rectal nerve and vessels, and we can very boldly write this is S2, S3, S4, right? Because these are just the contents of it. So this is good, this is good. Perforating nerves, that's okay. Sacrotuberous ligament needs no introduction, we know about it. Posterior scrotal nerves and vessels, that's fine. That's what we just mark, because that's the only new thing. Otherwise rest of the structures, they are known to us, right? Focus on these, right? Levator ani, external anal sphincter, and the reference of that external anal sphincter, that it has got deep part, it has got superficial part, and it has got subcutaneous part, and they are under voluntary action. So when we'll be discussing the anal canal, when we'll be studying the defecation process, at that point all these things will make sense, and then we'll even be watching those real dissections, right? Because in real dissections, it would happen that structures would be so similar, right? So unless and until the concept is clean, there can be some confusion. So that's what we are trying to avoid today. Okay. Now adding one extra thing. Say in this entire system, this portion is, now you know that this is ischio-anal region, right? Or the space. And this one, which is so superficial, this is perianal region. Perianal region. This ischio-anal space or ischio-anal region is a very common site for ischio-anal abscess, formation of pus. Right? This is a very common site. And whenever two cavities they are communicating, it is what is called as the fistula. Right? It is called as the fistula. So this fistula, it can be like this. Say it is going all the way towards, say this is just a section, right? So fistulous tract, it can open to skin, right? This is external, or it can open into this anal canal over here, right? So that is ischio-anal abscess, and which is getting converted into fistulous tract, either into the skin, that is the external word, or into the anal canal, right? So that's what we try to emphasize into this. Now specific about the male perineum. So scrotum, anti-abdominal wall, thigh, anus, gluteal fold, natal cleft, penis, all those are good. This is just a nerve supply, right? That's the nerve supply, cutaneous innervations. This would be a sort of theory, dorsal nerve of penis, ilioinguinal nerve. See how important, ilioinguinal nerve and genital branch of genitofemoral nerve. These nerves we have seen, right? So they are quite familiar to us. Perennial branch of posterior cutaneous nerve of thigh, posterior scrotal. This is the figure, right? You try to draw and just write down all those nerves. Just because right now we have touched only these nerves, rest of the nerves have not been touched. So just for the reference you can remember it. But now we'll draw the most confusing part, right? In fact, we'll try to understand this fascia part. This is superficial fascia, and in fact this is the last topic for today, right? This superficial fascia is divided into superficial and deep, right? And then there would be a deep fascia, that is a separate fascia. So this superficial part of superficial fascia, right, that is fatty. And the deep part of superficial fascia, that is membranous. Till this point, these layers, they were not making much of the trouble. But now, these fascias, they'll be actually creating all those pockets, and all those pockets, they are given some name. Right? So that's why it makes a complete sense. This is also called as the Scarpa's fascia, right? And this one is called as the Colles fascia. Superficial, it is fatty, and we already saw, right? It will be just merging with the surroundings, right? With the skin, continues. It is this deep or the membranous part, right? Remember, still there is a deep fascia. So it is this Colles fascia. How it will be? From both the sides, pubic arch, right? And then it would be merging with the fascia of penis, scrotum, and in scrotum there was dartos muscle, right, which was handling that temperature regulation. So we talked about it when we discussed the scrotum, right? So remember this part, that it is the pubic arch where this fascia is connected. Now what about the deep fascia? This deep fascia, it would be the thickening of this fascia is what is called as the perineal membrane. And you remember perineal membrane, right? Just to recollect, that perineal membrane which was having that free border. So that perineal membrane which was having that opening of urethra in case of male. So this membrane is nothing but it is deep fascia's thickened avatar, right? It is the thickened avatar of this deep fascia, and that is what is called as the perineal membrane. Perineal membrane. How the enema work here so that the rectum is okay. Now once again we are going back to that figure, right? What we drew by ourselves is this. So this one is pelvic cavity. ठीक? And then we divided it into two parts. And we said that yes, there is deep pouch and the superficial pouch, right? Deep perineal space or the deep. So just do like this one. So this is what is called as the superficial fascia of urogenital diaphragm. So what exactly are we doing? This is what? This is that perineal membrane, right? So here it is, writing it in bold. This is perineal membrane. And perineal membrane is thickened, thickened membrane or the thickened fascia. So thick fascia. So if there is superficial fascia of urogenital diaphragm, perineal membrane is inferior fascia of urogenital diaphragm, right? So inferior fascia of urogenital diaphragm. So think it like that this entire area, right? There is superficial fascia, but the inferior fascia is thickened, and this inferior fascia is only on the anterior part. This posterior one, right? This is anterior. This is posterior, correct? And this is anal region. So we are talking about urogenital region. So obviously this would be like a free border. So that free border, that portion which would be pierced by urethra, right? Which would be pierced by urethra. So that is thickened portion, that is perineal membrane. This concept, if it is clean, bus you have one, right? Because this is the most so-called complex thing. As such, it is not very complex. Okay. So what is this? That is a deep pouch, right? Deep pouch, deep perineal pouch or deep perineal space. So something which is lower, that would be called as the superficial perineal space. All right. So let's change color, and because this is very schematic, it is for our understanding. So that's why this would be called as the superficial perineal pouch. So if it is superficial perineal pouch, so then who is he? Which layer is this? Well, there comes that membranous layer, right? Membranous layer of, that's right, superficial fascia. Correct? That is the membranous layer of superficial fascia. And what would be still superficial to superficial fascia? That would be that fatty layer. Here it is. That fatty layer. So this one is the fatty layer, right? That is the fatty layer of superficial fascia. Now, are the things falling into proper place? Right? We said that superficial fascia, it has got fatty layer and the membranous. So here is the fatty and here is the membranous. After membranous, right? So there would be this pouch. So that is superficial perineal pouch, done. Then there is perineal membrane, right? This is the membrane which is only into the anterior half. Posterior border is free. This perineal membrane is basically thickened fascia of that deep fascia. This deep fascia has got superficial, right? I think just a minute. I have to change it. This is not superficial. It has to be superior. Now it is okay. Superior. Now it's fine. So superior fascia. Good. So that superior fascia and the inferior fascia has thickened and we gave them new name perineal membrane. It is this perineal membrane which is of very specific interest, right? And that inferior fascia, that is the thickened perineal membrane, superior fascia, that's what leads to formation of this deep pouch. So we have got deep pouch, perineal membrane, superficial pouch, and the fatty layer of superficial fascia. That's how all the structures are arranged anteriorly, right? This is a schematic diagram. And posteriorly, anal region. Sorry. So if we really draw it, right, very simply. So there would be over here and over here. That would be ischiopubic ramus, right? Ischiopubic ramus. Two muscles, because we have talked about only two muscles, right? One, levator ani. Why levator ani should be over here? Because this is actually the anal canal, right? That's where it will be handling the anal canal. And one who is over here, that is the obturator internus, correct? So obturator internus and the levator ani. Now we are changing the color because it is this region where first thing first, and that is the perineal membrane, correct? Perineal membrane. And then on top of it, there would be superior fascia of urogenital diaphragm, right? So that's the superior fascia, right? In between, this would be the deep pouch, correct? Deep perineal pouch. And then just below this, right? Below, that would be the membranous layer of superficial fascia, and this one would be the lower one would be the fatty. So this one is fatty fascia, this one would be the membranous, this is the superficial pouch, that one would be the deep pouch, and in between this is the perineal membrane, right? This is coronal section. In this coronal section, watch for things which are again known to us. That is, first thing we'll pick up is perineal membrane, because now we know about it. This is perineal membrane, right? So just above this perineal membrane, right, this is pelvic fascia, right? That is pelvic fascia. And see this superficial perineal space. Yes, that is superficial perineal space. It makes sense, right? Regarding this membranous urethra, this I am deliberately not touching, right? Membranous urethra or all those say ischiocavernosus or the proximal urethral sphincter. See, urethra itself is a big topic. So we'll first discuss it and then we'll come to this. But over here, just understand this part, that perineal membrane is what you have say understood, and it is pierced by, yes, important is, see here, it is pierced by, right, urethra. Bus, this much is sufficient for this point. Okay, right, without any trouble you will understand that this is perineal membrane. The question would be that it is pierced by, right? Four things to be remembered: artery, right? Deep, because all of them, they will be the deep artery of penis or dorsal artery of penis, right? Or the nerve, etc. So we'll remember it like that it is the deep and the dorsal artery of penis. Add nerve over here. So there would be dorsal nerve of penis also. And for the vein, it is the deep vein. And because we have extended it from this, so deep dorsal vein of penis. This way, you'll be able to pick up most of the structures. So this is deep artery, this is the dorsal artery, this is the dorsal nerve, and this is the deep dorsal vein. 4. So that way, you pick this, this, 4 major structures, right? Those structures which are on the tail side. Then urethra, that is okay. So there is a urethral artery, and rest of them, say muscular branches, posterior scrotal, bulbourethral glands, right? Again, bulbourethral glands, right now, till this point, we have not talked about. This we have talked about perineal body. So be comfortable with this perineal body. And in this perineal body, how many muscles? 10 muscles, right? Those 10 muscles you should know, right? Just another view where it is telling that, see, this is the bulbospongiosus, right? That's the perineal body, and this is the superficial transversus perineum. Now, at this point, this particular topic, right, what we are about to explain in book, I'm explaining it because it is given in book. But otherwise, without learning urethra, it won't be making much of the sense. But still, what we are trying to do is, let's say in case of male urethra, right, male urethra, it's a long course. So this portion is what is called as the penile urethra. That's the penile urethra, that urethra which is going into the penis. If it is ruptured over there, because above this perineal membrane, it is the membranous urethra. So over here, this urethra, it can rupture. If it ruptures, then the urine which is into the bladder, right, it will go to other place, and that is what is called as the extravasation, right? It is called as the extravasation, when that urine will go to other places. So if this rupture is below this membrane, right, so in that case, right, see the rupture, this is the damage. If it is below the membrane, so it would go into all these spaces, it will go into the scrotum, right? It will go into the scrotum. It will go into this lower abdominal wall, right? It will go into surrounding the penis in all those soft tissues, but it will not go up, right? It will not go up. See the difference when it occurs like, and this is like, so this portion, this lower, this is nothing but it is superficial perineal pouch. Now, same thing when the rupture is above. See this term. Now, immediately you'll say, yes, in that case, this urine will not be going into the scrotum because this rupture is above, right? So, in that case, it will go into all those. They say this is what? This one is prostate, right? That one is prostate. And that's the neck of the bladder, right? That's the neck of the bladder. That's the urinary bladder. So, here, that's where the extravasation would occur, right? It will be into that extra peritoneal space around prostate, bladder, right? All those areas. So over here, this is a rupture of, and that's what is called as the membranous urethra. So when we'll be discussing urethra, at that point we'll be discussing all the parts. But over here, at least you know this part, that it has got the membranous urethra and second is the penile urethra, right? So these are the parts. So whether the damage is into membranous or it is into the penile part, right? Within 5 minutes, we'll go for a very high speed revision of only the keywords, because tomorrow we are going to add lots of content into it. And at that point, we'll also be adding, say, revising this, plus we'll be adding learning the female perineum, right? So let's go very fast. And you'll find that now it is, say, this is the area where the perineal membrane is connected, right? And we said that it is on pubic arch. Yes, this is the pubic arch. So that is good, right? Pudendal canal. There were structures which were passing through pudendal canal. You know that, right? Ischial tuberosity, pubic symphysis, all good. This is the perineum lower end, right? In between two thighs. That is the place for external genitals in case of male, 2. In case of female, 3 openings. That's the area which we are talking about, right? Dividing into this urogenital region and the anal region, right? That's okay. And then we said that here it is. At that point, we just said this is the thickened fascia, right? We didn't talk much about it, right? Deep and superficial. Urogenital region, anal region, that's fine, right? These are the boundaries. And in case of male and female, and these are more specific. Now here is where we are talking about the perineal body, right? In front, urogenital region; behind, anal region, all those sacrotuberous ligament, coccyx, and the pubic symphysis, arcuate pubic ligament, all good, right? We said that we need to remember this because it will come again and again. Yes, it was coming S2, S3, S4, inferior rectal nerve, S4, perineal branch, right? That is for the skin around anus, and this is the skin around posterior. So here it is for the fascia, superficial and deep, right? Ischioanal fossa and the fascia of pelvic diaphragm, that is obturator internus. All those 10 muscles, so that is first external anal sphincter, levator ani on both the sides, right? Then those superficial transverse perineae and deep transverse perineae, finally the bulbospongiosus, and we figured out that there is a method, right? Blessed. So this is bulbospongiosus, levator ani, external anal sphincter, superficial transverse and deep transverse, and this is one, that sphincter. It is in the form of longitudinal muscle, what we saw. Episiotomy was the procedure in which perineal body is damaged, which can lead to prolapse of urinary bladder, uterus, ovaries, rectum in advanced cases. Here, anal sphincter and right over here to internal anal sphincter and the external anal. This is deep, superficial, and the subcutaneous. And what is its importance? Yes, the moment we see S2, S3, S4, yes, we know rest of the thing, and it is into with voluntary control, correct? And this keratin part, right? Keratin part, white line of Hilton, also known as the inocutaneous line, and it was the junction above. It is non-keratinized and over here it is keratinized, right? Keratinized squamous epithelium by John Hilton. That's our perineal membrane, which we said that do remember free border, right? And it is pierced by urethra, right? That's the urogenital region. And here is the ischioanal fossa. That's the posterior one, right? Regarding this horseshoe recess, etc., don't worry, right? It will come tomorrow. Yes, external anal sphincter, that's the anus. Anal canal itself is a topic which we'll be discussing. Another view, right? This view, we know all these longitudinal muscle, levator ani, obturate internus, their fascia, which is covering ischium, ischial tuberosity, and that white line of Hilton, etc. That's where the levator ani, right? And the anterior and posterior, just for the reference. This figure will come tomorrow again. Pudendal canal, we wanted us to be familiar with it. So pudendal nerve and internal pudendal vessels. And what are the contents of ischioanal fossa? Well, ischioanal fossa. So the moment we say S2, now we know rest of the things. And just add posterior scrotal and the labial nerves. Right? That's the location of ischioanal fossa. Right? Here it is, ischioanal fossa. So that's a sacrotuberous ligament. This is inferior rectal. So we added S2, S3, S4, perineal branch of S4, right? And this is like posterior scrotal nerve and vessels. Levator ani, external sphincter. So that's about the perineal body. And this is the perineal membrane. This one is the perineal membrane. That's the free border pierced by urethra. And then ischioanal region and the perianal region, and we were interested in discussing that what exactly is the fistula, right? Same thing. And this is a cutaneous innervation, superficial and the deep. Superficial is also called as scarpa, S for S. Deep is Colles fascia, and it is attached on that pubic arch, right? And going towards scrotum. This is the deep fascia, which would be thickened, and it is also called as the perineal membrane. Here it is. Here it is. That's the perineal membrane, right? Which is a thick fascia. Or we can also say inferior fascia of urogenal diaphragm. There is superior fascia, and it is giving us deep pouch. Below, this is the membranous layer of superficial fascia. So that is giving us the superficial pouch. And finally, most superficially is the fatty layer of superficial fascia, right? Same thing, we just drew it again. And that's the coronal section where we saw that the perineal membrane and getting pierced by that urethra. Few vessels, right? At least these four structures, that is the artery. In case of artery, it is deep artery of penis, dorsal artery of penis, dorsal nerve of penis, and the deep dorsal vein of penis. So these are the four structures important. Finally, this is the urethral artery, and the posteriorly, these are the posterior scrotal nerve and arteries, right? Perineal body, 10 muscles, we know that part, right? Just same thing. And this is for that extravasation. In case of rupture of urethra which is carrying the urine from bladder all the way to the exterior world, in case if it is divided into two parts, that is this is the penile part. If penile is damaged below the membrane, right, so it goes into the scrotal, into the penis, and to the lower abdominal wall, right? Over here, if it is ruptured above, so in that case it goes into the extraperitoneal space, right? This is the extraperitoneal space, peritoneal space around prostate and urinary bladder, right? So that's where it would extravasate. So this was the beginning, right? Tomorrow we'll be adding more contents to it, right? For tomorrow, these concepts, they are more than enough. So just go through it so that you know about those muscles, you know about these pouch. That's it, right? Thank you so much. And tomorrow we'll be adding more to this in our second part, that is peritoneum part 2, right? Thank you and bye bye.